talk about a disease today that just isn't spotlighted enough, sickle cell. It is inherited and it's affecting about 100,000 people in the U.S. People of African descent make up 90% of the population of sickle cell patients. My guests today are two sickle cell disease experts, Drs. Cece Calhoun and Dr. Layla Van Doorn. Welcome to you both.
Thank you for having us.
You bet. All right, Cece, let's start with you. For those who do not know, what is sickle cell and how does it affect people? How is it so debilitating?
Yes, so as you noted, sickle cell is an inherited genetic disorder of the red blood cell, our blood cell that carries oxygen to all of our tissues and keeps us healthy. When a person inherits sickle cell disease, instead of their cell being shaped like what I say, like a jelly donut, it's more so shaped like a crescent, a banana, or a sickle, which is why it's called sickle cell. But in addition to being shaped differently, it's also very rigid, brittle, and sticky. And so as those blood cells are going through our blood vessels, our pipes, those cells can stick to one another, meaning blood can't flow through. They can maybe scrape up the sides of the vessels, causing inflammation. And when our tissue can't get blood, we have consequences, the most prominent being debilitating pain.
Boy. All right, Layla, do we test babies for this? How do we find out that a person has this?
Yes, we do. So it wasn't actually until 1974, New York State was the first state to mandate into law newborn screening. So every baby that is born in the United States now has newborn screening for sickle cell disease. I would say that one caveat to that is that there's different forms of sickle cell. The most common is hemoglobin SS disease. So occasionally it can be missed if, for example, a baby is born with a different genotype, which is sickle beta thalassemia or hemoglobin SC disease, or if somebody was born outside of the country and then immigrates into the country, they may not know that they have sickle cell disease.
So the earlier we find it, the better the treatment?
Absolutely. The earlier that we can detect it, we can provide education to the patient, to the family, and then disease-modifying therapy.
All right, Dr. Calhoun, what about treatments?
Yeah.
You know, how do we give folks hope that have this?
Yeah. So, you know, we've known about the genetic cause behind sickle cell disease for over 100 years. And even still, we probably have less than a handful of treatments that we can use to treat the actual disease. Much of what we do is treating symptoms from the disease. And so we have oral medication that can work to prevent the cell from sickling or encourage the body to make less sickle cells and more fetal hemoglobin or hemoglobin we made when we were a baby. But really, up until recently, the only cure that we had for sickle cell disease was bone marrow transplant. Right now, it's an exciting time in our field with the advent or with the new FDA approval of gene therapy for sickle cell disease, which offers a new cure, hopefully, for persons who have disease.
So you can wipe it out.
Yeah. So, you know, what we do, all the cells that we make in our blood are made in our bone marrow. And so when you get a bone marrow transplant or when your own parent cells for your red blood cells are modified genetically, then the goal is to decrease the amount of sickle cells in circulation and thus offering a cure.
And one last question. If somebody doesn't know they have it, what are the symptoms? If they're sitting around.
Sure. So the most common presentation is pain. And it usually starts around 6 months of age or so when the fetal hemoglobin decreases. So the fetal hemoglobin actually protects against sickle cell disease. But there can be many other complications. Basically, anywhere the blood flows in any organ, there could be complications. So sometimes patients will come in and they'll have a stroke or they'll have recurrent infections, pulmonary infections, that's called acute chest syndrome. So there's just a myriad of ways that sickle cell can present, but the most common reason is presentation is pain.
I am so glad the two of you are working on this. I so appreciate you coming in and keep us abreast of what's going on with sickle cell.
Thank you so much for having us.
You bet.
Thank you.
And if you would like to know more about sickle cell, the treatment, etc., go to WTNH.com or the News 8 app.